Hi, Dr. Darrow here. Very excited to speak to you about the healthy brain. So let's dive right in and talk about our goals for today. So there are three messages that I want to get across. The first one is, what is dementia? How do we define dementia? How is it, say, different from Alzheimer's, or is it the same thing? Secondly, we're going to talk about hearing loss. So if you're wondering why hearing loss, well, what we've learned in the last decade is that untreated hearing loss can actually increase the risk of developing cognitive decline and dementia by as much as 200 to 500%. Yeah, you heard me correctly. Untreated hearing loss can increase the risk of cognitive decline and dementia by as much as 200 to 500%. Okay. Third, I want to talk about new treatments that are available for the medical treatment of hearing loss and how that impacts not only quality of life, but how it can increase cognitive function and how it can help to reduce your risk of developing cognitive decline. Okay, go ahead and read this. Everyone knows someone who is a cancer survivor, but no one knows an Alzheimer's survivor. It's a pretty scary reality when you think about the diagnosis of dementia or Alzheimer's is essentially a death sentence. Unfortunately, there are zero, not even one FDA-approved treatment for Alzheimer's or dementia. Pretty scary. And you probably read in the newspaper about a year and a half ago that Pfizer, one of the world's largest pharmaceutical companies, overnight closed their dementia research center. Why? Because they had nothing in the pipeline. They had nothing to show for 20 years of research and probably billions of dollars invested, but they had nothing to show. That's how far away we are from the treatment of Alzheimer's and dementia. So let's define dementia. All right, we're talking about a decline in mental ability that's severe enough to interfere with daily life. Okay, so it basically gets in the way. And if you think about the dementia diagnosis, okay, the way you get diagnosed is you have to have at least two, right? Two of the five, and they're listed right up here, 2 of the 5 core mental functions that every one of us has. It's as if we're all born with these 5 core cognitive functions: memory, communication and language, ability to focus and pay attention, reasoning and judgment, and visual perception. Now, I want to go through quickly each one of these, but I want to put a specific focus on hearing because I want to start to transition to how hearing loss and dementia are correlated, how they even end up in the same sentence or the same conversation. So if you look at memory, right? So right up here, memory is the first one on this list. And let me ask you the most obvious question, which is, if you can't hear me, could you possibly remember everything I say? Of course not. The obvious answer is no. So hearing loss gets in the way of the ability to store what you've heard, to store that memory of what you've heard. Okay. Second, communication and language. Now, you know, every relationship that you have, that you've had since birth, is based on the ability to communicate and language. So whether it be at work, whether it be at home, whether it be at church, communication is the basis of every relationship. And communication has both speaking and hearing. So when hearing loss gets in the way of communication, that too can put you at risk for developing dementia. Let's go to the third one, okay? One of the most common complaints that I get out of my patients is that they have difficulty in background noise, right? So there's a lot of issues when you go to a restaurant and there's some competing noise in the background and they say, you know, I have difficulty paying attention. I have difficulty being part of the conversation. So right there, hearing, that core function of hearing gets in the way of the first 3 core cognitive functions: memory, communication and language, and the ability to focus and pay attention. There's also reasoning and judgment. Like I said, not driving to the right house. And then visual perception. You know, I stop people all the time and I say, hey, you're wearing glasses. Are you wearing those glasses because you know it helps to reduce your risk of dementia? And they say, no, I had no idea. I just wear them so I can see better. Of course, right? When you have a sensory deficit like visual impairment, you must treat it. And little do most people know that if you do not treat your visual impairment, that can significantly increase the risk of developing cognitive decline and dementia. Now that should really make sense because you're depriving the brain of visual input. The same goes with hearing. You're depriving the brain of sensory input, right? Did you know hearing loss is the #1 sensory disorder on the planet? That's how big of a deal it is. Okay, so hearing loss and its impact on cognition. I want to take you down a little memory lane. Go back it's been about 8 or 9 years now since we started to realize that hearing loss and dementia may be related to each other. Now, the first groundbreaking research that came out from Dr. Lin and his colleagues at Johns Hopkins, right? And you see it right up here. It's that top one, hearing loss and cognition in the Baltimore Longitudinal Study of Aging. Now, in this study, they were looking at everything, right? They wanted to understand how human beings age and what is the aging process, right? What happens to our bodies? Well, they looked at everything. And perhaps the most stunning finding that landed on the front cover of every newspaper, it was on PBS, it was on the Today Show, it was everywhere, this highlight that hearing loss is correlated with cognitive decline and dementia. In fact, if I can summarize the data, you can look right here, okay? This is pretty powerful. I'm going to step out of the way. The risk of dementia with untreated hearing loss increases by as much as 200 to 500%, right? Look at that mild category. That's pretty impressive. That tells you, that's one of my sort of famous phrases, that a mild hearing loss is a major problem because even a mild hearing loss can increase the risk of developing cognitive decline and dementia by as much as 200%. Now, unfortunately, the sad fact is that when I see patients, most of them come in at the 300% mark, right? I have a talk with all of my patients that you waited a little too long. It's not too late, but you waited a little too long. And so now your risk, because you already have a moderate hearing loss, your risk of developing cognitive decline and dementia is as much as 300%, okay? So now let's start to talk a little bit more about hearing loss. So if we did a little quiz, what would you guess the #1 cause of hearing loss is? Now, when I ask this question, I get a lot of answers, okay? I get noise exposure, loud noise, whether it be at work, whether it be at play, like at concerts. Yes, that is certainly a big one, but that, honestly, is really #2. I also get medications. Yes, there are a number of medications, especially those in the chemotherapy family used to treat patients with cancer, that can impact hearing and destroy some of those cells inside the ear. That's about #3. And then I have a lot of people say aging and genetics. And actually, they're both right because the #1 cause of hearing loss is aging. The #1 cause of age-related hearing loss is genetics. It's assumed that up to 75% of people have an age-related hearing loss gene. Now, there are a number of them, but that basically is 75%. That's 3 out of every 4 people are carrying a gene that makes them susceptible to age-related hearing loss. Now, you add in noise on top of that, maybe some medications, maybe some illness. Well, now you've really increased your risk. It's essentially, it's a matter of fact. It will happen to almost everybody. Is that up to 50% of people, half the number of people between 60 and 70 years old have hearing loss. Once you get over 70, so between 70 and 80, nearly 2/3 of people. And then once you get over 80, 80% or more of people will have hearing loss. What exactly happens, all right? It's really an amazing thing with hearing loss. But first, let's talk about the normal ear-to-brain connections, okay? So on one side of the screen, you see the ear, okay? The ear, the cochlea, looks like a shell. And on the other side of the screen, you see the brain, okay? Let me just step out of the way. So You see, when you're looking at this, you see the ear, you see the brain, and you see these really bright arrows that connect the ear to brain. Those arrows essentially represent millions of neural connections from the ear to the brain. Now, let's look what happens with hearing loss. It's pretty stunning to see the difference, right? I'm going to show you that again. So here's the normal ear to brain connections. And here's what the ear to brain connections look like with age-related hearing loss. It's pretty stunning to realize, okay? Now there are two things that are happening. Number one, there is a quantitative reduction in the number of nerves that connect the ear to brain. You catch that? There's actually a physical reduction. See, when the cells inside the ear die, the nerves that connect them from ear to brain, well, they die too. Those can't be retrieved. Number two, what you'll notice is that there is a qualitative reduction. A qualitative reduction in the nerves that remain. You see those three nerves up there? See, what's happening is they're weak. Now, guess what happens if you don't stimulate those nerves? You're probably all thinking that famous saying, use it or lose it. You're exactly right. If you do not use it, you will lose it. If you do not use those connections from ear to brain that remain, you will lose them. That is why hearing loss is classified as a progressive degenerative disorder. And so when you seek treatment from a medical specialist, what you're actually looking for is not just some amplifier that makes things louder. You're looking for specific neurotechnology that can provide auditory biological feedback to help stimulate all of those nerves, okay? Keep them going. You want to try to get out ahead of this progressive degenerative disorder so that you can slow it down, so that you can maintain the connections that you still have from ear to brain. Now I want to go through what are the consequences, okay? So I told you, progressive degenerative disorder, but what does it mean for you or your loved one who's suffering with hearing loss? Let's go through that. There are three consequences of this neural degeneration. Number one, tinnitus, okay? Tinnitus is technically defined as a phantom sound in your ears or in your head, or perhaps in both, okay? Now let's talk about why tinnitus. How does that happen, right? So here's an interesting statistic. There are 50 million people that report having tinnitus. Guess how many people report having hearing loss? Yeah, you guessed it. 50 million people. As the nerves break down from ear to brain, the brain goes looking for that input that it was used to, that it's lived with perhaps, the first 50, 60, 70 years of life, and now it's gone. And the brain goes searching for it, and in return, your brain hears a ringing or a buzzing or a swishing or a swooshing. I've heard nearly every adjective out there. So remember this slide, right? Remember this one where there's a quantitative reduction. So if you'll allow me, I want to take 1 second to talk about phantom limb pain. Many people have heard of that, right? So here's a case where perhaps somebody goes off to war or they're in a tragic accident and they lose a limb. Those patients will tell you that they can still feel the missing arm or the missing leg. And many times they will tell you that they feel intense pain in that missing leg or missing arm. See, what happens is the brain is accustomed to the stimulation from the arm or the leg. Now, when you remove the arm or the leg, well, the brain goes looking for that input. And so the brain tries to make up for that missing signal and it senses pain. Now, thankfully, in the auditory system, there are no pain receptors. But you guessed it, there are sound receptors. So what that means is the brain is going to make up for the missing signal by inserting a sound, a ringing, a buzzing, or a swooshing. And so the goal of treatment, which by the way, we have an 80% effective treatment rate. There are new FDA-approved treatments for tinnitus that we are having tremendous success with across the Excellence in Audiology Certified Provider Network, okay? Nearly 80%. That means if you come in, we can essentially make the promise to you that there's an 8 in 10 chance that we can significantly reduce your tinnitus. Number 2, let's talk about how this neural degeneration results in auditory deprivation. So from the minute you're born, your brain is accustomed to auditory input. So as we get older and we lose that auditory input because of hearing loss, because of the cells and the nerves breaking down, now the brain is being deprived. And there are large swaths of the brain that are stimulated by the ears. So symptomatically, what this means for you or your loved one is that there's going to be reduced clarity. What most patients will say is that they miss the beginning, maybe the end, maybe even the middle, right? Let's say there's a joke being said and you heard everything right up until the end. Now you have a choice. You can either ask the person to repeat or you can just laugh along with everybody else, okay? No. The third option is to treat your hearing loss and hear what everybody else is saying, even in a noisy background, okay? That brings me to can't hear in background noise. To hear in background noise, right? That amazing ability that we have when we're younger, where you can go to a crowded restaurant or you can sit around a holiday table, and there's lots of input, right? Lots of people speaking, maybe the radio's on, but you can filter the background and you can really focus in on what it is you want to hear. Well, with neural degeneration from the ear to brain, you can't do that anymore. You essentially need all hands on deck. You need 100% of the system working in order to hear in background noise, which is why it's really one of the earliest symptoms that my patients have, which is, I think I'm having difficulty. And I think the natural instinct of most patients is to blame it on the room, they blame it on the background, perhaps they blame it on their grandson, who they insist mumbles, although nobody else tends to think that they mumble. Okay, number 3. Let's talk about how neural degeneration results in cognitive decline. And I'm really going to dive in deep on this topic, okay? There are this triad of theories of how hearing loss and dementia are connected to each other, okay? So there's social isolation, there's cerebral atrophy, and there's brain overload. So allow me to go through all 3 of them, okay? Let's start with social isolation. Now, I want you to be able to read this quote. Blindness separates you from things. Deafness separates you from people. It's a very famous quote. It's a very telling quote, too, from Helen Keller. So if you don't know Helen Keller, she was both deaf and blind. And she was asked on numerous occasions if she had the option, which one of her senses would she retain, her vision or her hearing? And every time she said that she wished she had her hearing, and she would use this quote, that blindness may separate you from things, which seemingly aren't that important, but deafness separates you from others. Okay, let's go to number 2, which is cerebral atrophy. See, cerebral atrophy is defined as a significant loss of nerve cells in the brain. So if you look on the screen, you see an image of a brain with normal hearing, okay? It's nice, it's plump, it fills out most of the skull. However, you also see a brain on the other side that has hearing loss. It's a pretty profound image, right? You see that it's smaller. What the studies have shown us, and there's been a number of reports on this, is that there's up to a 40% loss in brain volume, and specifically in some of the areas of memory, speech, language, and hearing, right? Because there's not just one little part of the brain that's involved in hearing. There's a global network that's involved in hearing and understanding and storing memory of what it is you've heard. Okay, third, let's go into cognitive overload, right? Many patients will tell me as they come in for their first appointment, at the end of the day, they're exhausted, right? They tell me they go to work and they have to listen 10 times harder than their normal hearing peers, right? When you have normal hearing, you don't have to put forth any effort. It just comes naturally. It's not something that you have to think about. But when you have hearing loss, you have to try to fill in the missing pieces. You have to work hard people with hearing loss are excellent lip readers because they're trying to fill in the missing pieces. So let me give you a little example, okay? I'm going to step out of the way. I want you to try to read this. See, it takes an extra second. And what you'll notice is I actually took out the consonants, which is what people with age-related hearing loss lose, right? So this sentence, "Dear Karen, how's everything? Will you meet me tomorrow at McDonald's? Love, Howard," right? You might have figured it out, but it took a little extra time. Now imagine that being part of a rapid conversation where somebody's talking to you and you miss 20, 30, 40% of what's being said to you. Which brings me to, I want to talk about the medical treatment of hearing loss. I want to talk to you about some of the advances. These are only in the last couple of years. Advances in treatment, advances in testing, advances in follow-up care in terms of treating hearing loss. So let's go through the 4 benefits that every patient is expected to experience when treating their hearing loss with a neurotechnology process. Okay, for starters, increased quality of life. Statistics are overwhelming, right? There's a report from the National Council on Aging that shows people who treat their hearing loss have significant improvements in overall quality of life, in relationships at home, and self-esteem. Let's go to number 2, which is increased cognitive function. Yeah, you heard that right. Treating hearing loss can kind of improve brain power. So a study came out of the University of Texas, El Paso, okay? It's a fairly simple study where there were a group of subjects who had hearing loss and did nothing about it. Then there was another group of patients who had nearly the same hearing loss and they began treatment, okay? And in under 2 weeks, 14 days, they found significant increases in selective attention, memory recall, and processing speed. Let's go on to number 3. We want to try to provide the proper stimulation to reduce tinnitus. Okay, let's go on to number 4, which is that the medical treatment of hearing loss may significantly reduce the risk of cognitive decline and dementia. So I want to show you a report. So the European Dementia Commission, the world's largest dementia report, there were scientists from across the globe, researchers from across the globe, who basically wanted to understand everything, the current state of dementia. And the 2 most important findings, right, and this is really critical here. The 2 most important findings is that 1 in 3, so 35% of people with dementia were considered preventable. Perhaps I could have helped my grandmother and we could have helped her to avoid that dreadful diagnosis of dementia. Okay. Secondly, really one of the most important things that came out of this report was they listed everything you can do to help reduce the risk of dementia. Right there towards the top, one of the most powerful things that you can do. One of the most important modifiable lifestyle factors for the prevention of dementia is the early treatment of hearing loss, right? I want that to really sink in. The early treatment of hearing loss is perhaps one of the most important things that you can do. One of the easiest things that you can change in your life to help reduce your future risk of developing cognitive decline and dementia. Our treatment program is simple, low monthly payments, okay? That includes everything you need. Full lifetime warranty, pair of neurotechnology hearing aids. All your supplies are included. And the thing about hearing loss, because it's a progressive degenerative disorder, as your hearing and cognitive needs change over time, we will also adapt the treatment program and change your technology accordingly, and you never have to worry about a thing. Okay, so my final take-home message, I appreciate you sticking with me to learn all this valuable information. Aging is inevitable, but decline is optional. So which do you choose? Thank you so much for being here with me. Take care, everyone.